Well, I am well. I'm even better just knowing I'm going to be talking to you from
There you go.
Doctor.
Hey, there we go, Terry. Well, thank you
you
for calling.
Doctor, could you help me with an idea or two that you have to help me with this essential tremor?
All right, Terry, how old are you?
I have just turned the big 80, which
Okay,
is a new
congratulations. There you go. New 30. I like the way you think. Actually, with an eraser, you can make it look a little bit like 30. Okay, and how long have you had this essential tremor?
About 2 years, doctor, and it's really, really ganging up on me at this point. It's much more severe.
Okay, are you taking any medications at the present?
Yes, I am.
What might you be taking?
You were talking about one I've taken. You talked about the topiramate.
Okay, Topamax.
I've been through the Topamax.
All right.
And, of course, gabapentin.
Okay, neither of which helps, actually, but go on.
No, I don't think it does either. I think I'm throwing my money there. And the last one, at least at this right time, the last one is carbidopa.
Carbidopa is interesting. Okay, so how long have you been on the carbidopa?
About, let me see, probably 3 months.
Okay, has it made any difference that you can feel?
Negligible, I think.
Okay, cool. What I would suggest that you do when you're looking at benign resting tremor or essential tremor, the assumption there is that it doesn't look Parkinsonian. The older you get, the more Parkinsonian symptoms people generally develop. But if you just have a resting tremor, okay, the way that I like to approach it is by using two things. I'll use something called L-tyrosine, okay, which is an amino acid. The dosage that you start with is 500 milligrams 3 to 4 times a day. If you're tolerating it, you can increase the dosage to a 750 milligram capsule. That actually converts into dopamine. Carbidopa is weird, okay? It sometimes it helps, sometimes it doesn't. But if you can push the production of dopamine this way, it works very, very nicely. The second one, which is actually kind of weird, and you wouldn't think it would work if you understood why I use it, and it's called phenylethylamine, or PEA. Phenylethylamine also converts very much the same way, but I use it as an anorectic. It's a weight loss medication. But the third thing, and the place I'd like you to start, is with magnesium. And I'm starting to sound repetitious. In medicine, they call it perseverance, but magnesium is a wonderful muscle relaxant. Okay, the dosage is very, very tricky. You have to go slowly with it, especially when you hit that fourth let's say, what score of life. You hit 80, things start to go a little bit more bizarrely. But I would start with 200 to 300 milligrams of chelated magnesium at night, and then during the day, you would divide the dosage in half and repeat it. In other words, 200 milligrams twice a day, bisandium, if you like the pharmaceutical or pharmacy statement, but 400 milligrams at bedtime. Give that a try, Terry. Let me know, and we'll work it from there.